Okay, this time let's talk about the different essential characteristics of long-term care. So there are 7 of them, essential characteristics. So variety of services, individualized services, well-coordinated services, maximum possible independence, extended period of time, holistic approach, and quality of life. So what do these all mean? Well, these are characteristics that need to be present in every long-term care facility. So let's discuss each of them. Variety of services or variety of healthcare services. Now, long-term care needs vary greatly from individual to individual. We have to keep that in mind. And the type of services needed changes over time. And this depends on the changes in the health and also the level of functioning of the individual. In this characteristic, it's also emphasized that therapeutic and preventive services are necessary for the person receiving the care. And therefore, there should be an interface with non-long-term care services. We're talking about case management, for instance, or other services that people in receiving long-term care services can get outside of that facility. Indeed, the person is institutionalized. The next one is individualized services. So individualized services simply means that the assessment of the patient's physical, mental, and emotional condition and the past medical and social history are utilized and analyzed, and all this information that they get from the patient's history, they're all used to develop a very unique and individualized plan of care for the individual. Services must be well coordinated. Simply put, there should be a sound coordination of services. So the availability of services may not be sufficient to meet different and changing needs of long-term care clients. So therefore, these services must all be well coordinated. So somebody is actually managing the plan of care of the patient. And this is very important because the healthcare system is often difficult to navigate, even more so for people who have lost a lot of independence, and they tend to depend on case managers and other people. That's why, if they get institutionalized. Next characteristic is maximum possible functional independence. So there are 2 standard measures. In the previous section, you actually saw the checklists, as I have mentioned them earlier, the activities of daily living and the instrumental activities of daily living. So they are a scale, and they are standard measures that are used to determine how dependent or independent a person is. Depends on how you look at it, but the higher the score means the higher level of independence. The lower the score means the higher level of dependency, meaning the higher need for long-term care services. Activities of daily living, or ADL scales, is used to assess a person's ability to perform certain common tasks. Common tasks such as activities of daily living. And instrumental activities of daily living, or IADLs, it's a scale, incorporates activities that are necessary for living independently in the community, and these are the ones that require the use of some instruments. Taking a bus, using the phone, counting the medications, and these 2 scales are very important in measuring the progression of dependency in any given patient or client. And the main goal of long-term care is for the individual to maintain functional independence to the highest and the most maximum level that is, allowable and it's practical. You could use the use of adaptive devices such as wheelchairs, walkers, and the idea is to promote independent functioning as much as possible. The next characteristic is extended period of time. So basically, what we need to remember is that long-term care can extend over a period of time. And this could be difficult both for families as well as clients, patients receiving long-term care. And therefore, there's the need for coordination of care. It could be weeks, months, or years. And the next one is holistic approach, and there are 4 dimensions that need to be addressed. Holistic approach incorporates physical, mental, social, and spiritual needs into the healthcare delivery and the living environment and the setting where the client is at. For our students in the recreation therapy, this is where you come in. So, for instance, for physical aspects, so these are the technical aspects of care, such as medical, nursing care, rehab, diet, also includes a clean and comfortable environment. As far as mental domain is concerned, so an individual's mental and emotional well-being, like anxiety, depression, even boredom, living environment includes layout, decor, things that promote intellectual stimulation and also positive feelings. Even like the way things are laid out, or even the color of the walls and the decor, things like that. The social aspect, we tend to look at like warm friendships, social relationships. Can you find this in an environment of a long-term care setting? And is it an environment that provides opportunities for socializing, for people to actually interact with other clients in that institution? And of course, the last domain is spiritual, and people have unique and their own individual personal beliefs. They will have their own values, commitments to religious and faith contexts. Now, some people maybe don't identify themselves to belong to a system of belief, meaning they don't identify as part of any type of religion, but the spiritual need still needs to be addressed. Last but not least is quality of life. So quality of life is a total living experience that results in overall satisfaction with the way one's life is going. And lifestyle factors such as personal enrichment and meaningful activities are very important. So a comfortable, safe, and appealing living environment is key, and it's very important for people or clients that are in chronic pain. Clinical palliation or pain management, which is relief from pain and discomfort, is also key. And in terms of human factors, quality of life actually can be very much affected by this. So we're talking about caregivers. Are they professional? Are they caring? Are they compassionate? And do they preserve the patient's dignity? Autonomy and independence is also important here. Are we giving as much latitude to the patient to govern his or his own life and, the choices that he makes?